Stomach pain and severe or prolonged vomiting. University of Washington School of Medicine doctors say those are some of the issues chronic cannabis users are complaining about as they show up to the emergency room. KOMO Stella Sun live this evening outside UW Medicine in South Lake Union with the new details about this increasing trend doctors are seeing. Stella?
Preston, doctors say for years some cannabis users, chronic cannabis users, have been coming into the ER with stomach pain as well as severe and prolonged vomiting. But thanks to some updates by the World Health Organization, doctors can now diagnose these patients with cannabis hyperemesis syndrome. In emergency rooms across the state,
it seems like we see a lot of people coming in with this nausea and this vomiting. It's really hard to treat and a lot of belly pain.
The UW School of Medicine says over the last decade, ER doctors have been treating more patients experiencing these problems.
As you start talking to people a little bit more, you find out that they use cannabis pretty regularly, and suddenly it all kind of makes sense.
Until recently, there was not an official name for what these chronic cannabis users were dealing with.
Cannabis hyperemesis syndrome. So emesis is throwing up, and hyper means throwing up a lot.
The World Health Organization updating its classification of diseases manual. Doctors can now diagnose cannabis hyperemesis syndrome, helping addiction researchers collect data and evidence on the impacts of chronic cannabis use.
Now that we have a name, we can better educate the society to understand that cannabis, yes, helps to control nausea in some people. It's very helpful for some people, but the other side is the opposite. They also can provoke very painful cyclic vomits with a lot of stress.
As concrete numbers get collected on cannabis hyperemesis syndrome, a potential treatment for chronic cannabis users.
Does a hot shower help? And they're like, yeah. And this is the only thing I know of that is really treated with a hot shower.
Now, UW Medicine says despite an uptick in these cases, in these hospital cases, a lot of clinicians aren't too familiar with this, and that's because it's fairly new. They say that naming it will help these doctors better diagnose their sick patients. We're live here in South Lake Union. Stella Sun, KOMO News.